Yes, of course, this epidemic can only be addressed by all parties working together. And we were in the happy situation that our colleagues from our unit DEFCO B5 had already, before the epidemic, worked on the provision of laboratories that can detect such diseases and such outbreaks, and that they could then deploy more to the region to help to diagnose the disease. That's the first step. But of course, then there needs to be a second step, and that is taking care of the victims of the disease. And I think all people have now seen all these Ebola treatment centers or treatment units that have been established that require very rigorous procedures, hygienic practices, so that the health workers do not get infected. But at the same time, the disease in its early stages, it looks like many other diseases. It looks like malaria or other viral infections that can be treated and that are not infectious or not as infectious as Ebola, and that usually were treated by the healthcare workers. So once a case is diagnosed with the help of those laboratories, is taken care of by a treatment center that has been supported by ECHO and the Red Cross and the Médecins Sans Frontières, who are usually contracted by our humanitarian office. Nevertheless, people want to come to the basic health service facilities and get their treatment for ordinary diseases, but the health staff at the same time may be very afraid that these people may as well have Ebola. So we need to support them. They are taking risks. They are really the heroes often in this situation. They are taking risks, and many of them have died, actually, because of that. But despite their very low pay and despite other very adverse conditions like lacking equipment, many of them nevertheless continue to work, and it is these people that we need to support with our development programs so that they continue to do that, because the treatment centers alone will not solve the problem.
Maybe tackle also the difficulty to settle all the diagnosis means. It's not only diagnosis, of course. There are challenges in medical trials for treatments, even for vaccines. The challenge is huge. Of course, the first line of differential diagnosis is very important, especially with malaria. And there are technical issues, even to know what to give to diagnose Ebola at treatment and transit center, but also what field diagnosis means and kits can you give to the health workers in the health centers and post. What capacity do they have to handle precisely suspected Ebola case with what condition? We are aware that in some cases the patients are not accepted, they are rejected at health center just because it's too dangerous. So how to face this, it's very difficult. And we know that there are several, coordination is also important. We know that there are several actors in it, CDC, ECDC, Pasteur. There are national laboratories. One of them, or several of them have had to be closed because laboratory personnel has been infected. So it's a huge task in itself to determine all the protocols. In some way, help from abroad is completely necessary because the national facilities are not able to cope with that.
Our first point of contact, obviously, from the delegation is our geographical coordination desk in DevCo, and then obviously we have thematic input with the thematic desk, but also with the Instrument for Stability. We're not involved in the project per se, but of course, obviously, we coordinate with the Instrument for Stability on that. They have different mechanisms which allow them to respond in certain cases a lot faster, and this was they were instrumental in getting those mobile labs on the ground very, very rapidly. And that is, that's fantastic. So there is a complementarity in approaches.